You've probably heard the term bad cholesterol, right? It gets thrown around all the time. But what does that even mean? What exactly is LDL cholesterol and why has it earned such a, well, bad reputation? Let's get into it. So, really, what is the deal here? What makes this one little thing in our blood so, well, so bad? Turns out the answer to that question is absolutely crucial for understanding and protecting your heart. All right, so let's start with the basics. To really get why LDL has this bad guy reputation, we've got to know what it is and, more importantly, what it's doing inside our bodies. Okay, so what are we actually talking about? LDL. It stands for low-density lipoprotein. The easiest way to think about it is like this. Imagine it's a tiny delivery truck for fat or lipids cruising through your bloodstream. Now, one truck? No big deal. The problem is when you have a massive fleet of these trucks and they start getting stuck. That's when you get a major traffic jam right inside your arteries. And this right here is what that traffic jam turns into. These stuck fatty deposits, they form something called plaque. The pipe analogy is perfect. It's literally like gunk building up and clogging a pipe. And as that plaque builds up, the pipe, your artery, gets narrower and narrower. That makes it so much harder for blood to get where it needs to go. And this is why we're talking about it. This whole clogging situation, it's a huge deal. It dramatically ramps up your risk for really serious stuff. We're talking heart disease, heart attack, stroke. It can even mess with the circulation down in your legs. So the takeaway here is high LDL isn't just some number on a piece of paper. Nope, it's a direct threat to your entire circulatory system. Okay, so we've established what LDL is and why it's so dangerous. The big question now is, how do you even know if your levels are too high? Well, that's exactly where testing comes into play. And the good news is, finding out your LDL level is actually pretty straightforward. It's just a simple blood test. Think of it like a snapshot. It gives your doctor a really clear picture of how much of this bad cholesterol is floating around in your system at that specific time. But here's the thing. You'll almost never see an LDL test done all by itself. It's actually part of a bigger panel, a lipid profile, that gives your doctor the whole story. This test also looks at your good HDL cholesterol. That's the stuff that helps clean up the mess, plus other fats like triglycerides and VLDL. So yeah, the team report analogy is perfect. LDL is just one player, but you got to see how the entire team is doing to know what's really going on. All right, so if you've got one of these tests on the calendar, there are a few simple but really important steps you need to follow to make sure you get accurate results. It really comes down to 3 key things. First, fasting. You'll probably need to stop eating for about 9 to 12 hours before the test. Simple enough. Second, you gotta be an open book. Tell your doctor about everything you take, and I mean everything. Prescriptions, over-the-counter stuff, vitamins, supplements, you name it. And third, and this one is so critical, do not stop taking any of your regular medicines unless your doctor specifically tells you to. That's a big one. Okay, now for the part everybody's waiting for. You've got the test, you've got the results, but what do these numbers actually mean? Let's decode them. So the main rule of thumb here, it couldn't be more simple. When it comes to your LDL number, you want it to be low. That's it. There's no gray area here. Lower is always better. Now, there is one number that's like a universal red flag. No matter who you are, if your LDL level hits 190 milligrams per deciliter or goes any higher, that is always considered too high. It doesn't matter what your other risk factors are. That's a number that says, hey, pay attention to me. But, and this is a big but, it's not always that simple. This is where things get a lot more personal. Your ideal LDL number isn't a one-size-fits-all thing. You can see here if you have other risk factors, like diabetes, or maybe you already have heart disease, your doctor is going to set a much lower target for you. For folks in these high-risk groups, a number over 70 can be the signal that it's time to take action. Okay, so this all might sound a little scary, but here's the really good news. A high LDL number is not a life sentence, not at all. You actually have a ton of power to change it. So let's talk about how you can take back control. You know, I love how this is laid out because it's so clear. Look at the left side. Those are the main causes of high LDL, right? A diet high in saturated fats, not moving enough, being overweight. Now look at the right side, direct, powerful solutions. It's almost like a perfect mirror image. You can fight an unhealthy diet with a healthy one. You can fight a sedentary lifestyle by getting regular exercise. It's so direct. These are your biggest weapons in this fight. So let's put it all together. Here is your action plan, broken down into 6 steps. We've already hit the big 3: eating healthy, getting exercise, and managing your weight if you need to. But don't forget, quitting smoking and cutting back on alcohol are also game changers. And honestly, the most important step might just be number 6. Talk to your provider. Always. They are your partner in this, and they can help you build the perfect plan for you, whether that includes medicine or not.
All right, as we wrap this up, I want to leave you with just one thought, one question. You don't have to overhaul your entire life tomorrow. That's not how it works. But just think about it. What's one small thing, one simple choice from that list that you can do for your heart starting today?